want to call upon the last last speaker for this plenary section. My name is Dr. Andrew Kanter. Dr. Andrew Kanter is currently the president of the board of directors of the Physicians for Social Responsibility, and he has been a board member for about 10 years. Dr. Andrew Kanter is a board member of IPPNW. He is currently an associate professor for clinical biomedical informatics and clinical epidemiology at Columbia University, New York. Dr. Andrew Kanter will be speaking on the social and ecological cost of armed violence in selected African countries. His topic seeks to bridge the gap between the global north and the global south as we negotiate for a robust arms trade treaty. Dr. Andrew Kanter.
Thank you, Gabi. And thank you to the Nigerian mission for hosting us today. Today is Compassion Day, and so I'm going to try to talk to you a little bit about this topic of economic and social implications of armed violence, particularly in Africa, from a physician's perspective. I am a doctor. I'm president of Physicians for Social Responsibility and also on the board of the International Physicians for Prevention of Nuclear War, whose aiming for prevention program is really the reason that brings me here today. I've been working on issues of peace and international health and development for more than 30 years. I have traveled or worked in over 50 countries, and I'm currently spending most of my time working with the Millennium Villages Project, which is helping to achieve the Millennium Development Goals in 10 sub-Saharan African countries. Over the past 30 years, as a medical student and as a physician, I've had the opportunity to see the direct and indirect consequences of arms in many countries. As physicians, we are frequently called on to repair, if possible, the devastating damage inflicted on the fragile human body by guns, bullets, and other munitions. I do not need to show you the horrific pictures of what I am referring to. The panelists before me have expressed this better than I could. But I have been struck by the power of the one bullet stories put together by young IPPNW doctors and medical students both in Africa and Asia, where they track the history of individual cases of armed violence. They explained how the victims first presented, such as one example of a young man who was shot in the face by rebels who thought that he might have diamonds, and then their medical care, such as the surgeons who spent hours in theater putting that young man's face back together. They document the many long miles of travel and the extensive expense and suffering caused by this one bullet. Whether through the actions of armies, criminals, or rogue elements, whether in Africa, Latin America, South Asia, Southeast Asia, or even in my own country, the United States, armed violence inflicts a terrible toll on the lives and property of the people. While working in Southeast Asia, I saw example after example of people whose bodies and minds had been ripped apart by the conventional arms. I live in New York City now, but even in my former city of Chicago, there is an epidemic of shootings this year, and there have been over 250 killings. One of my co-panelists, Diego Zavala, has led a multinational injury surveillance system in Africa, and he can attest to the impact of violence on the men, women, and children of Africa. Technology can help shine a light on the nearly 750,000 people killed each year by armed violence. It can help count the uncounted. It can help share their stories. I spend a lot of time with new developments in information and communication technology. I can tell you that we have many new tools, such as mobile phones and low-cost computers, that are available to us to help monitor and evaluate the impact of the arms trade. There is no excuse anymore for not accurately assessing the costs and numbers of injuries and death caused by armed violence. We only need to make the investment. But it is not just the direct effects of guns and ammunition that I want to discuss today. I also want to talk about the indirect effects that the arms trade has on the health and well-being of all of us. The tremendous costs of armed violence on the very fabric of our society is frequently overlooked when we frame our insecurities in terms of terrorist attacks, crime, or fear of external enemies. In this context, we often find that psychologically, we are willing to spend any amount of money in an attempt to feel secure. But this is not only unsatisfactory as a way to address potentially valid concerns. It is likely to be self-destructive by siphoning away attention and resources from solutions which truly do increase our security. Protection of the environment, alleviation of poverty, strengthening of family and community are all more effective ways of ensuring health, safety, and well-being than our guns. The reliance on weapons is a type of mental affliction that we must address if we are to survive. So just how much do we spend on this false treatment of our fears? The world spent $1.7 trillion on the military last year, and that was according to the 2012 Swedish SIPRI report. That's $249 for every man, woman, and child on the planet. The United States alone makes up almost half of that total amount, with $711 billion, or nearly $2,500 spent for every person in the United States. Overall, although spending has remained relatively flat since last year, in Africa, driven mainly by spending in the north, spending has actually increased by 8.6%. $20.4 billion were spent last year in Africa, or about $20 for every person on the continent. As a comparison, in sub-Saharan Africa, the average spending on health is only $24 per person per year. In the project that I work on, sustainable achievement of the health MDGs looks to be possible by spending of somewhere between $30 and $40 per person per year on health. For example, for countries in the Sahel, investment in poverty alleviation and environmental sustainability might have reduced the likelihood of what is now a violent military operation. Arms do not create security. Peace and development do. In Africa, if we could transfer this spending on the military to health-related programs, we would have a real chance of sustainable development. I want to come back to the one bullet story I mentioned earlier. The money required to repair the damage caused by that single bullet could have been used to immunize 250 children or to send 100 children to school for a year. At a time when we are just beginning to make progress on achieving the Millennium Development Goals, when focused and integrated efforts at development are achieving real reductions in the morbidity and mortality of mothers, children, HIV, TB, malaria, at a time when the global economic crisis threatens to siphon away much needed resources, we cannot afford to spend trillions of dollars on weapons. The economic meltdown in 2008 and the continued economic crisis across most of the world might have put a damper on spending just about everywhere. But the amount of arms transfers actually increased by 24% between 2006 and 2011. It is good business to be making and selling arms. But is this the kind of business we really need? Although Africa receives only 10% of global arms traffic, these numbers are likely substantial underestimates, as only one country in Africa actually reported their arms transfers under the United Nations Registry of Conventional Arms. Illegal arms sales, gifts, or other forms of arms transfer do not increase security, enhance development, or protect our health and well-being. The continued lack of transparency of the arms trade allows it to continue to flourish and prevents all of us from having a real discussion about how we are going to protect ourselves, our children, and our future. It is time to finally listen to one of the great American leaders, a general and a president, Dwight D. Eisenhower, who said all the way back in 1961 in his farewell address to the nation the following, quote, every gun that is made, every warship launched, every rocket fired, signifies in the final sense a theft from those who are hungry and are not fed, those who are cold and are not clothed. This world in arms is not spending money alone. It is spending the sweat of its laborers, the genius of its scientists, and the hopes of its children. Unquote. The arms trade treaty being negotiated this month here at the United Nations must be successful. It must be strong. It must be inclusive of not just guns, but of ammunition. It will not address all of the concerns raised by this panel or by civil society. However, it will be an important, committed step in helping the world come to terms with its addiction to these dangerous and counterproductive instruments of death and destruction. I know that wittingly or unwittingly, we all help perpetuate suffering. Everyone in this room probably has consumed more of their fair share of resources, even just getting here to participate in this important treaty conference. We don't always do the right thing, and sometimes our selfishness hurts others. However, there are a few times in our lives when we really can do something that makes a difference, that makes a substantial improvement in the lives of our fellow human beings. I hope that we can look back on what we achieve here with this treaty as something that we can all be proud of. That is something that we can tell our children and grandchildren about. How we help turn the tide of violence and pessimism and destruction towards a new beginning. Together, you and I and the delegates in the room downstairs can help ensure a safe, healthy, and sustainable planet for all people. That is at least one physician's prescription for true happiness. Thank you.
Wow. It was really an